You know, following this experience, it's really been quite fascinating because I have had a third of my life involved in healthcare, either as a patient in the Children's Hospital or as a worker at the Holy Cross. I was there for a little over 10 years, and I've noticed a big change, not a good change. So I've started watching I always watch the news, but I've started following the pre-negotiations for the new health accord. And after reading Ackley, or however you say her name, the Federal Minister of Health's comments from the meeting this week held out in the Maritimes with all the provincial health ministers, where she makes it clear that this really negotiations won't happen for another 3 years. Well, this present program runs out in 2014. We're talking over $27 billion a year being transferred around to various provinces, with a 6% increase guaranteed up until 2016, at which point who knows what's going to happen. But you don't wait when you're doing that type of contract, that type of arrangement, until the last minute to negotiate. This is something that should have been started, from my opinion, at least 2010. You need a good 3 or 4 years to really get an agreement like this going. But this seems to be what our healthcare is about these days, is we'll wait till the crisis happens and then we'll react in a knee-jerk reaction. That's happening with Alberta Health Services. As I said, I was told yesterday, get in touch with the patient's concern line, which is nothing more than a call center, and they don't really give a damn. But when I watch the news on the current negotiations, the federal minister doesn't seem to give a damn either. It's like healthcare has become secondary in this country when it comes to programs. Prime Minister Harper would rather sit there and spend millions of dollars to watch some nice shiny planes fly over the sky so that he can get a nice photo op in front of a bunch of vets that are going to get thrown out in the trash as well once they leave that little photo op that he ran this week. His money's going to prisons that we don't need. The man doesn't want to listen to anybody on anything. This is all ideology driven. Healthcare isn't of interest to him. Let's lock people up. Let's put them in the army. Let's go to war, and let's make me look like a shiny war hero. I have a feeling that Harper's the type of guy that as a kid was always the last one chosen for a team and never got a chance to play soldier. I think he was too busy playing with his ovens and his little dolls. I don't know, the man's just friggin' bizarre. But to watch what's happening with the negotiations, and the health minister is saying, here's what we need, what are we going to do? And the federal minister says, I don't care what you're going to do, this isn't about negotiations, this is just about to decide how we're going to negotiate. Come on, let's get started on the negotiations and quit farting around. This is bad time for this to happen. This is going to be decided a year before the next election, and we're going to be stuck with whatever they give us at that point for a while. So people start paying attention to this as well. If you don't like what's happening with the current negotiations on our future health care, I can tell you from lying in this hospital now for, what's today, the 26th, so it's been a month, 29 days actually. I've had my eyes open a little bit more. You don't want to be here and then find out what it's like. So you pay attention to what's happening, because your parents are going to wind up in shitholes if you don't start paying attention. Your kids are going to go without services if you don't start paying attention. It takes you 2 minutes to fire off an email to your MP. It's easy to find it. Go to the website, the Canada government website, type in your postal code, brings up your MP, and gives you his or her email. Get some letter writing campaigns going. This is what social media is about. Quit letting this dictator we've got running this country ignore what you're saying, and you start being at least 5 minutes a week. Be active. Get some changes happening here, because our health care is falling apart on us, and our most vulnerable citizens are paying for it, including our parents. I would not want to see my father treated the way I've seen some of the things that have happened here. And it's not their fault, it's not the staff's fault. They're run off their ass trying to get things done. But it's so restricted, and this is going for the unions too. Unions, wake up and start paying attention. You're no longer professionals. You know, you become a business. You're as bad as some of the politicians out there. President Yuna's been in that, Heather Smith's been in that position for over 20 years. She's a professional politician now, like the rest of them. What the members need are being ignored because she's there to get reelected all the time. That's it for now. Talk to you later.